Yeah,
Hi, can I come in?
sure.
Hello.
Hello,
Sir, can you tell me your name?
I am Dan.
Hi, I'm Kathy. You prefer to be called Ben?
Sometimes.
Okay, well, today is okay to be called Ben?
Yeah.
All right, Ben. Well, I am here today to do an abdominal assessment on you, and then also we're going to perform some additional assessments, including those of the cranial nerves and just some motor and sensory assessments as well. So we're going to go ahead and get started. The first thing I'm going to do is just, and please note that I'm going to be recording my observations, so that's why I have my clipboard handy here. So the first thing I'm going to do is just observe the color of your abdomen and look for any scars or striae, any type of dilated veins, rashes, ecchymosis. And I'm also going to look at the umbilical area for any inflammation, bulges that might suggest a hernia. Also just make sure that it's located symmetrically and that there's not any type of inflammation. So I see normal skin tone. Doesn't appear to be any scars. You haven't had any abdominal surgeries that you're aware of. The temperature feels fine. Everything's nice and warm. I don't see any rashes or anything concerning. So the next thing I'm checking is just contour of the abdomen. I'm looking to see whether or not it's flat or rounded or protuberant or scaphoid. I'm looking to see if you have any bulging here along the flanks, making sure that everything is symmetric and that you don't have any visible masses or organs. Also, I'm going to be observing for peristalsis. Just on very thin people, that's observable. You can kind of see some things moving around in the abdomen, which would be normal. Okay, so far your findings are great. So the next thing I'm going to do is I'm going to listen for vowel sounds in all 4 quadrants of your abdomen. Okay, that's good. You have vowel sounds present in all 4 of your quadrants. So the next thing I'm going to do is also just listen to some different arteries that you have in the abdominal area. Listening to the aortic. Left and right renal. Left iliac. Right iliac. And then in the crease of the leg, I would listen to the left and right femoral arteries as well. Okay, so everything is normal so far there. So the next thing we're going to do is percuss all 4 quadrants of your abdomen. And we're also going to search for the tympany of your gastric bubble here in the left. Okay. Now, could you just please cough for me a couple of times? Okay, and when you coughed, did you feel any pain or discomfort at all?
No.
Okay, very good. So now what I would like for you to do is just relax and just exhale, breathe through your mouth with your jaw slightly open. And I'm going to begin to palpate your abdomen. First, this will be nice and light. Let me do this in all four. Any pain or discomfort there?
No.
Very good. So next we're going to check a little bit deeper. Okay. Any pain or discomfort there?
No.
Very good. Okay, so if there were any concerns at all, I would identify any masses and note the size, shape, location, consistency, if there was any tenderness or pulsations, any kind of mobility with respiration or pressure from my examination. So now what I'm going to do is just assess for any type of peritoneal inflammation. So we've already had you do a cough test and you didn't feel any discomfort there. I haven't noticed any guarding or rigidity, but the next thing I need to do now is check for rebound tenderness. So I'm going to press down in an area, and when I remove my hand suddenly, I want you to kind of let me know how that feels. Any pain? Any pain? And here?
No.
Okay, very good. So no rebound tenderness noted in those areas. So now what I would like for you to do, take a deep breath in, and let it out. Okay, so any pain or tenderness when you took a deep breath in?
No.
Okay, very good. We're going to consider that negative. Basically what I've done is checked your Murphy's sign, and it would be positive if you had pain and tenderness that was severe enough to cause you to stop your deep inspiration as I was pressing in. So now I'm going to check another area here in the left. You feel any discomfort there? Okay. So let me just check one more time. If I push in here and let go, do you feel anything uncomfortable? And if I push in here and let go, anything uncomfortable? Okay, so this is the roving sign here. When I push in and let go quickly, if you felt pain in this right area here, I would be concerned. But because you didn't have that problem, I'm considering it negative. Okay, so now what I would like for you to do, I'm going to put my hand here on your thigh. When I do this, I would like for you to try to lift your leg straight off the exam table. Go ahead, please. Okay, you can relax. Did you feel any discomfort in your abdomen when I did that? Very good. So that is considered a negative psoas sign. If you had pain, this would be felt in the abdomen, and that would be considered a positive sign. So the next thing that we're going to do, I'm going to flex your hip and then just carefully turn your hip in. Do you feel any discomfort in your abdomen when I do that? Okay, very good. That is considered a negative obturator sign. Now, do you feel anything uncomfortable as I do this? No uncomfortable sensations. Very good. So because you do not have an uncomfortable sensation when you do that, I'm going to consider you negative for cutaneous hyperesthesia. Okay, so now I am going to do a little bit of percussion here to see if I can identify your liver. So to do that, we're going to start below the umbilicus. I'm going to ask you just to put your arm down here to the side, just nice and relaxed. Okay, so your liver is between here and here. So now we're going to palpate. So I'm going to get under here at the 11th and 12th rib. And if you could just breathe in for me and out. Okay, and again. Okay, very good. So now I'm going to locate and percuss your spleen. And breathe in. Breathe in. Okay, very good. Okay, so ordinarily to assess the left and right kidney, I would start by assessing your left kidney. But in order to do that, I would need to be on the left side of your body. However, the way this examination room is set up, I'm really not able to assess. I would have to basically get into the bed, and I feel like that would not really allow me to appropriately assess. So the right kidney is assessed the same way as the left kidney. So therefore, I'm going to just go ahead and assess the right kidney, knowing that the left one would be assessed in the same way. So I'm going to use my left hand to lift up. And if you could breathe in and breathe out. Again. And breathe out. Okay, very good. And sometimes it would be normal to feel a little bit of tenderness in the right kidney. And sometimes the patient actually can feel the practitioner capture and release the kidney when that happens. Okay, so the next thing I'm going to do is palpate the width of your aorta. So to do that, I'm going to find your umbilicus and go just off to the side and feel for any pulsations on both sides. It's very important to do this for anyone that has cardiovascular diseases. Okay, so now if you could just put your legs over the side of the exam table and set up for me. Very good. And I'm just going to check for some CVA tenderness. Any discomfort? Any discomfort?
No.
Okay, very good. So that concludes the abdominal assessment portion. So now we're going to move on to a different assessment. So I can see that you're quite alert. You're able to answer questions appropriately. Can you tell me the date?
November 23rd.
And then can you tell me where you are today?
My nurse practitioner's office.
Very good. Okay, so now I'm just going to test some of your cranial nerves, and we're going to start with your olfactory nerve. So if you could just take a deep breath in for me and out. Do you feel like that's clear? And again, and out. Okay, now just keep your eyes closed for me. And can you sniff this? And what do you smell?
I smell cinnamon.
Very good. And over here.
Cinnamon.
Okay, great. You can open your eyes. So that was good, normal finding. So now what I would like for you to do is just hold this card out about right there and read the smallest line for me that you can.
LMTC1354.
Okay, very good. All right, if you could just look over my shoulder. Very good. And over my shoulder. Perfect. Okay. And then can you just tell me, when you see my finger?
Yeah.
And
Yeah.
very good. Okay. And so now what I would like to do is just check your pupils to make sure that they are equal and reactive. So are you ready? Very good. Very good. You have sensitive eyes. I'm sorry about that. Okay, look at this finger, please. And look at that one. And again. And one more. Okay, very good. Okay. If you can just look straight at me, and I'd like for you to follow my finger. Are you ready? Good. And again. Good. Okay, and I don't see any nystagmus, and I don't see any drooping of the eyelids, so very good. Okay, so now what I would like for you to do, look straight ahead, please. Clench your teeth. Okay, very good, just relax. Okay, now open your mouth a little and just wiggle your jaw from side to side. Perfect. Okay, if you could just close your eyes for me. I'm going to check some areas of each side of your face. So first of all, just know that this is sharp and this is dull, okay? Sharp, dull. So when I touch your face in these different areas, I would like for you to just tell me if it's sharp or if it's dull. Are you ready?
Sharp. Dull. Dull. Sharp. Sharp. Sharp.
Okay, very good. Okay, so if I were to have felt like you had some loss of sensation or some issues with that, I would continue on by using a hot and cold test, but that's not necessary because I feel like your test was normal. Now, because you have very sensitive eyes, you have already requested to omit the corneal reflex test. So I will explain to you what I would do if we were actually going to do the corneal reflex test. So what we would do is use a cotton swab, and I would tear the cotton swab in half and just use a very small portion of the fiber. And I'm not gonna do it, but I would just gently use that fiber to touch the cornea in each eye. And what would happen is the appropriate response would be that you would blink fairly rapidly and that you would probably have some tearing. But again, at your request, we are going to defer that exam today. Okay, so I've been kind of inspecting and examining your face during our conversation, and everything looks to be quite symmetrical, so no issues with that. What I would like for you to do is raise your eyebrows for me. Okay, very good. And then make a frown. Make a frown. Okay, very good. And then I would like for you to close your eyes very tight for me, please. Very tight. Okay, perfect. You can relax your face. And then can you show me your teeth? Very good. Can you smile? And then finally puff out your cheeks. Perfect. Okay, so we're going to continue on to assess the next cranial nerve. And so I'm going to check your hearing. Can you repeat that for me?
4-7-8.
Okay, very good. So if I had suspected any concerns with your hearing, I would continue to perform a few other tests using a tuning fork, but you were able to correctly answer that, and you've been able to hear our conversation well, so I'm not concerned. So meanwhile, I've been listening to your voice as we have been having conversation and going through our assessment, so I don't notice any hoarseness, any nasal quality. Do you ever have any problems swallowing?
No.
Okay. And can you just say ah for me? And say ah again, again, again. Okay, very good. Okay, and finally, I just need to check for a gag reflex. Okay, very good. Okay, if you could please just stand up for me for just a moment and turn towards this door here. And can you shrug your shoulders? And one more time, and one more. Okay, you may sit back down. Thank you. Okay, so can you turn your head towards my hand? Okay, very good. And then again. Very good. Let's do one more time. I'm just noting the muscle here. And looks good. Okay. Okay, so I've been listening to the articulation of your words and there's not been any issues with that. It seems like you're very able to articulate your words without issue. Can I just look at your tongue, please? Just normal. Okay, perfect. Now stick out your tongue and move your tongue to the left and to the right. Perfect. Okay, so everything looks symmetric with that and I don't really see any deviation as you stick your tongue forward or any muscle atrophy. So very good. So that is normal. So the next thing I'm going to do is just inspect the size and contour of your muscles so I can see that there's, nothing's concave. Everything seems good there. Okay, so now I'm just going to check your tone a little bit. Okay, very good. Okay, so now let's just check some muscle strength. Can you hold your arm up like this for me and then don't let me push down? Very good. Very good. Okay, and then let's check your wrist. Good. Okay, so now don't let me push back. Okay, same over here. Very good. And now don't let me pull. Good, same. Okay, and push against my hand. Push against my hand. Okay, now don't let me push your foot down. And same over here. Very good. Okay, so now we're going to check a little bit regarding your coordination. So I'd like for you to hold out a hand and touch each finger to your thumb and then back. Very good. Let's do the other side. Perfect. Okay, so can you touch this finger with your finger? And again. And again. Okay. Again. Again. Okay. So now close your eyes. Open them. Okay, touch one more time. Okay, now close your eyes and try to touch again. Very good. Okay, touch my finger. Okay, close your eyes. Try again. Very good. All right, so let's further check your coordination. I'd like for you to stand up for me, please. And I'd like for you to walk heel to toe across the room. And then turn around and come back towards me. Very good. Okay, so now if you could walk across the room on your toes and then turn around and come towards me. And again. Okay, and then finally, if you could walk on your heels and then turn around and come towards me. That's an interesting maneuver there. Okay, and then just have a seat for me, please. Okay, so let's stand up one more time. Just relax your arms, hold on to my hands, okay? All right, I'd like for you to hop on your right foot. Hop in place on your right foot. Okay, and then let's try your other foot. Okay, very good. So now let's do a knee bend on your right leg. Good, and then on the left. Okay, very good. You can let go and have a seat for me, please. Okie dokie. So let's stand up one more time. Okay, now close your eyes. Close your eyes. Okay, very good. So this was actually called a Romberg's test, and you have to stand with your eyes closed and your arms down at your side for 30 to 60 seconds, okay? It's okay to have some sway, but the important thing is that you can stand upright the whole time. So very good, okay? So now what I'd like for you to do is stand, hold your arms out like this. Okay, excellent. You may have a seat. Okay. So now I'm just going to do some testing of sensation. I'm just going to test different points of your body. Again, this is sharp and this is dull. Okay? All right. Do you feel that? So if you feel something, say yes.
Yes. Yes. Yes. Yes. Yes.
Okay. So now tell me if you feel sharp or dull.
Sharp. Dull. dull, dull, sharp, sharp, dull, sharp, dull,
Okay.
sharp, 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 dull, sharp, 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 dull.
Are your eyes closed?
Yes.
Okay.
Dull, 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 dull.
Okay. So ordinarily, this examination would be done while the patient is in an examination gown, and this test would probably be a bit more accurate because we wouldn't be going through layers of clothing. If I was concerned, then I would continue on with further tests, such as the temperature test. Usually this is omitted when sensation is normal. If it were not normal, then we would use the tube test method. So if you had an examination gown on and I was performing the sensation test on bare skin and you were answering dull and sharp incorrectly, I would continue on with this temperature test where I would use a test tube filled with ice versus one that's filled with hot water, and I would ask you if the sensation was hot or cold. Okay, so now we'll continue on with light touch. So just let me know if you feel something.
Yes. 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 Dull.
Well, it's just that you would feel something. Okay.
Yes. Yes.
Okay, so I won't attempt to do light touch through your socks or through your jeans, and would just assume that, you know, hopefully the exam would be as normal as what we're noticing here. But that's how you would assess a patient for light touch. Okay, so the next thing we would do is we would use a tuning fork to check for vibration, but I do not have a tuning fork available. Okay, well, we could use this, I suppose, but let's just go ahead and say, well, it seems to stop immediately when we touch it to the skin. A tuning fork should actually continue to vibrate for a little bit longer. So the goal of using the tuning fork would be that I would strike the tuning fork, we would have vibration for some time, and I would put the end of it on your fingertip and on the tip of a toe, and then kind of move closer into the core of the body, and you would let me know when you stop feeling the vibration of the tuning fork. Okay, so now what we're going to do is test for discrimination. So I'm going to need a fingertip, not that one. And I would like for you to close your eyes, please, and tell me if you feel 1 point or 2 points.
2, 1, 2, 1, 1, 2, 2, 2, 1, 1, 1, 2, 1.
Okay, very good. So now, if I could see the palm of your hand, please. Did I draw a number or a letter?
It could have been a B or a 3.
Okay, it was a 3. Okay, let's do another one. Eyes closed, please.
Could be a 4 or an A.
Okay, very good. Close your eyes. Hold out your hand. What do we have there?
It's a penny.
Okay, very good. Hold out your hand. What do you have there?
It's a quarter.
Okay, very good.
It's a quarter.
Okay, perfect. Okay. So I'm going to touch you in certain areas of your body, and I want for you to tell me if I'm touching one side or both sides. Are you ready?
One side. Both sides. One side. Both sides.
Are your eyes closed?
One side. Both sides.
Okay, very good. All right, hold out your hands for me, please. Close your eyes. Is this up or down?
That is up.
Okay, close your eyes.
That is down.
Okay, very good. All right, so just relax. The final thing that we're going to do is just a few deep tendon reflexes. Now, I do not have a reflex hammer available, so I'm going to, on some of these, I'll have to just kind of explain how it is done. So the first one that we do is the biceps. So you're going to just relax. I would place a finger over the bicep tendon and then use my reflex hammer to strike across my finger, and then I would see a reaction in the bicep. The next area that I would check would be the tricep, and that's going to be behind and just slightly above the elbow. I would strike with my reflex hammer and I would see a reaction. And then the next spot I would do would be the brachial radius, and so that's going to be about 2 inches above the wrist, and I would use the flat end of the reflex hammer to do that, and there would be a reaction in the wrist. And then the next spot that I would do would be the patellar reflexes. So you locate the tendon and then strike, and I may be able to get this one. Okay? And then the next spot would be the Achilles tendon. And so that is done, you would just kind of relax here, and I would strike the Achilles tendon, and there would be a reaction in the foot. And then I would check under here. This can feel kind of uncomfortable for some people. We're looking to make sure that the toe does not go up, but instead goes down when we do this. Okay. All right, and then we have one last reflex to check. If you could please just lay down for me. We're going to do abdominal reflexes. So in order to do the abdominal reflexes, we'd use a firm object and go up this way, down this way, up, and then down, and you would see a reflex in the abdomen and possibly even see the umbilicus deviate from one side to the other as those areas reflex. Okay. Well, thank you very much for letting me do your assessment today. Did you have any questions?
No.
All right. Thank you. You can sit up and get dressed, and then they'll check you out up front.
Okay.
Okay. Thank you.
Thank you.